Hello, I'm Dr. Shana Gleeson. I am a transplant infectious disease specialist, and I will be talking to you about traveling safely after your transplant. Many of these recommendations are most relevant for travel to other countries, but can be applied to domestic travel as well. The first step in traveling safely is to plan in advance. This will help you stay safe and healthy during your travels and will also help you access the resources you need if you do become sick while you are away. If you are planning a trip, contact your transplant team ahead of time to make sure you are well enough to travel and that all proper precautions can be taken. Avoid traveling to areas where there are high rates of infections or different kinds of infections, such as tuberculosis or malaria, during the first year after your transplant. Make sure you are up to date on all vaccinations before traveling. Depending on where you are going, you may need to take some special vaccines before your trip, and so you should discuss this with your doctor. Bring a summary of your medical history, current medications, and your vaccine history when you travel. Before you leave for your trip, talk to your insurance company about how your coverage extends to your destination, and consider purchasing medical evacuation insurance. It is important to know where to seek medical care in case you become ill while traveling. Prepare a list of transplant centers, specialists, and pharmacies near your destination, so you know where to go if you need medical attention. Bring your medications in their original containers. Do not bring loose pills that are not labeled. Bring extra doses of your medication with you in case there are travel delays and you are away from home for longer than expected. This way you will not run out of medication before returning home. Talk to your doctor about any additional medications you should take with you on your trip. Wash your hands often and bring hand sanitizer with you. Make sure you continue to follow COVID-19 precautions, including wearing a mask in crowds and airports and social distancing whenever possible. It is a good idea to bring a basic first aid kit with you in case of minor illnesses or injuries. There are many infections that can be transmitted in food and water. When you travel abroad, the food and water may be handled or processed differently, and so you can be exposed to things in food that you would not be exposed to at home. There are several precautions you can take to decrease your risk of getting sick from what you eat or drink. Drink bottled or boiled water. If you are not sure how safe the water is where you are staying, you should also use bottled water when brushing your teeth instead of water from the tap. Avoid ice in your drinks. It can be easy to drink soda or other beverages with ice without realizing you are consuming water, but if that ice is not made with bottled or boiled water, it may contain bacteria that can make you sick, the same as it would if you drank contaminated water. Avoid food sold by street vendors and avoid unpasteurized dairy products. This includes raw or unpasteurized milk and cheeses made with unpasteurized milk. If you are not sure how fruits and vegetables have been cleaned or prepared, then you should stick with eating fruits and veggies that you can peel yourself, such as bananas or carrots. It is very common to develop traveler's diarrhea, which is usually related to eating or drinking something contaminated with bacteria. The best way to avoid this is to follow the food and water precautions we just reviewed. Before your trip, talk to your doctor about bringing an antibiotic with you in case you get diarrhea. If you do develop diarrhea, make sure you stay hydrated by drinking lots of fluids. Water is key, but make sure it is bottled water. If you develop severe diarrhea, or you develop vomiting, blood in the stool, or fever along with the diarrhea, you should seek medical attention. Let's talk about travel to hot and tropical climates. You can easily become dehydrated when outdoors in the heat, so make sure you stay hydrated with bottled water. It is important to protect your skin from the sun after transplant. Make sure you have protective clothing, a hat, and sunglasses to wear when outside in the hot and sunny weather. Malaria is an infection that is transmitted by mosquitoes in many tropical climates. Before your trip, you should talk to your doctor about whether there is malaria where you are traveling. If there is, your doctor may need to give you a medication to prevent malaria while you are traveling. Mosquitoes can transmit malaria as well as other infections. For this reason, it is important to protect yourself from mosquitoes. You can do this by wearing protective clothing, such as long pants and socks. Wear insect repellent that contains DEET, especially when doing outdoor activities. If mosquitoes can get into the room you are sleeping, you may want to use a bed net. If you will be in an area where there are a lot of mosquitoes, consider wearing clothes impregnated with permethrin, which helps repel insects. Hopefully you stay well throughout your trip. Keep in mind that some infections cause symptoms right away, but some can cause symptoms that develop many days after your initial exposure. You should contact your transplant team if you develop fever, diarrhea, rash, or any other new symptoms after returning home from your trip. Thank you for listening, and I hope you found these tips helpful in preparing for your next trip. Remember, this is not meant to be overly restrictive or limit your travels. Rather, this guidance is intended to help keep you safe and healthy as you travel after your transplant. Good luck and enjoy your trip.